So let's talk about how charities can help you. I found out about Look Good, Feel Better because of talking to a lady when I was in being treated for the Campylobacter before they put me in my own room. And she said she'd been on this course, which was like a half a day, and they showed you how to apply makeup and wear scarves and so on to make you feel better about yourself because you're not looking your best, let's be honest. And I was really grateful. It was just a leaflet like this, and I'd seen adverts on the television for Look Good, Feel Better, but I didn't really know how it worked. So this was before COVID, obviously, and they were doing their workshops in Velindre Hospital. So I rang up and they managed to get me in for one in August when I was about halfway through my chemo. Most of my hair was gone by then, so I just went in with a scarf on and took my wig, no makeup. And you're in a room, there was about 12 of us around the table actually, and back then, before COVID, you were given a bag full of goodies, cleansers, toners, creams, blusher, foundation and so on, and they tried to tailor it to fair skinned people and darker skinned people, and it was, that was great. And this is all donated by makeup companies, and it was started in America. Someone who was in media and went through cancer and thought there should be help out there to make the best of yourself when you're going through it and lift your spirits. And it just grew and grew, and then came to the UK, and they've got over 100 different outlets for you to go to. So we sat there, and I was close by to Kylie, who was actually in her early 30s, so a lot younger than me, but we hit it off, we exchanged telephone numbers, and a lot of good came out of that. But what was really good was just being with other cancer patients who really understood what I was going through, which is a byproduct of the getting together to show you how to put your makeup on. And they were sharing their experiences, asking questions, and I was amazed. I just loved hearing other people, their experiences so similar to mine, and getting answers to questions which I also had. So that was really good, and things with Look Good, Feel Better for me have progressed because during lockdown they asked if I'd take part in this Zoom online sort of virtual workshops, and I was really happy to do that. We were locked down, and it was so lovely to have that contact with the outside world and with other ladies who'd gone through what I had. So if you go on the Look Good, Feel Better website and you have a look at there's sort of an advert for the virtual workshop, and I'm the one with the curlers in, because I didn't really think it through, but I liked the big reveal. So when we started it, I had my curlers in and put my makeup on, and at the end I took the curlers out. But there is a clip, which is the main advert with me with the curlers in, so that didn't work out so well, did it? Anyway, then later on they asked me if I would be interviewed on Sky News and talk about my experience, which I did about the actual workshop in Cardiff and the virtual workshop and the benefits that came out of it. And I've been involved in other things with them since. And it is available to so many people that it is worth me telling you about it. And I've mentioned it to friends when they've been going through cancer treatment, and they say, oh, okay, but they don't do anything about it. But my feeling is, even for those 2 hours, if it takes your mind off your fear, your anxiety, thinking about how you feel if it's not a great day, it's worth doing. Anything that is a distraction, and that really is. And they now do one on nails. By the way, I did have terrible nails for a while, but they've now come back to what they were like before, which is great as long as I look after them. So they show you, and I did one of their workshops on nails, and I learned a lot from that, even though I've been doing my nails for years, always do them myself. So that's worthwhile. And I don't know what is in your area, but I talked about Tenebris before, Cancer Charity. And this was a leaflet that they passed to me when I went up to their mobile unit. And it's frequently asked questions. It talks about counselling, and they did telephone me and offer me counselling at the beginning of when I was having the chemo. But for me, I just wanted to kind of get my head down and get through the treatment, and then I thought I'll do some counselling when I come out the other side if I need it. But you know, it's never a bad thing to talk to a counsellor, and who knows, it might have been a help if I'd done it then. But I in fact did it later, so I'll talk about the clinical psychology service, which was provided by the National Health Service, and which I benefited from actually in recent years. It took a while because I was on a waiting list. But find out what is available, and you can ask your oncologist nurse what charities are there that can offer me help, or they may even just hand you leaflets when they're putting together your plan for treatment. So don't just say, I'm going to do this myself, I don't need any help. Think about your long-term benefits from not suffering in silence when you can have some help.